Atlant Medical Center.
Today, we will diagnose our beautiful Anya. We will see what is wrong with her back, with hips, legs, with a bite. In this case, we'll start with the bite. We show our beautiful teeth at the camera. Smooth, good teeth. Look at me and slowly open and close your mouth.
Good. One more. Yes.
Now, the legs are together. Socks, heels together, handles forward and close our eyes. And look at the difference in the length of the fingers. This is very important. Those who do not know why, you can watch the video with Margot. The link is in the description. I will not repeat this in detail here. Your fingers and hands are the same length, and I conclude that your shoulders are at the same level. In the sense of height and along this trajectory. The same in height and ventrally dorsally, in the sense forward-backward. And now I will take a closer look at the levels of the horizon. For this, I have to sit down at the level of your shoulders, so that my eyes are at the level of your shoulders. Because it is wrong to look like this. When I see on the internet that some specialists, doctors, of a high rank diagnose like this. How can the human eye see the horizon from different angles? Okay, now we look at the hip line. You can see the parallelism by the elastic band. Legs. Everything is exactly here. Okay, now turn your back on me. Look here. There are bony landmarks in our body, and we look at them. This is a visual diagnosis, and with our fingers we feel this palpation diagnosis. And now I can feel it with my fingers, this bony tubercle, the iliac crest. Uppermost bony protrusion, higher than my right toe. Can you see that the left finger is higher? Now let's figure out why. To do this, you just have to walk back and forth. I sit down and watch you walk. To me. A little bit faster. Yet. On toes now.
Okay.
I understood that one hip joint does not work for you, it is blocked. Correct diagnostics must be done while lying on the massage table. Now we will do it. I will continue to watch your back for scoliosis for now, and so on. Hair forward. Tilt your head. Turn to camera. I do a visual palpation diagnosis along the entire spine. Run it with my fingers, and look at the evenness of the vertebrae. Smooth. Now you need to bend over and reach the floor with your fingers. Yet. Okay. Now turn your face here and bend over, so that you can see that you have a perfectly straight spine. I don't know how you can see it on camera, but I can see it from here. Stay straight. And now I need to exclude the legs from here. That is, I feel that the left ridge is slightly higher, the right one is lower, and now we will put something under your leg. A book or something. Now we will find and check 100%. Now we have taken books on laboratory diagnostics, and I will put books of different thicknesses under your feet, and check the level of your hip bones. I turn the patients back to me, and put a book of medium thickness, under the right leg. And watch. No, it has risen very strongly. We remove it. I put in a thinner book. I don't know if it's visible on camera or not. Turn around a little. Now it is very high. The right finger is high. Before that the left finger was higher. So I ruled out the legs. The legs are not to blame. Now we will check our legs while lying. But so far I like everything, and I am inclined to the diagnosis, that this is a block of the hip joint. Now let's move on to diagnostics on the massage table. Look, you have such a problem here, with the hip bones. Our pelvis is divided into 3 bones. This is called the ilium. This is the ischial bone. Here are the ischial tubercles, we sit on them. And the sacrum, these are 5 fused paired vertebrae of the sacral region and the coccyx. Many say we fell on the butt and hit the tailbone. Here a man falls. Don't trust anyone. How can you hit your tailbone? The ischial bone gets hit. If we fall like that, then it gets hit. Sacrum. This is called the promontory of the sacrum. When I put my fingers, I put them on these hillocks. And on the left side it was slightly higher. Why? We are going to figure it out now. Lie on your back. We will look at the length of the legs. Visual palpation diagnostics. We look at the bones, but your right leg is slightly longer. A little. It is solved by the insole. See an orthopedist, perhaps a heel or insole under the left leg. We are all of different lengths. Here I have this biceps more. This one is smaller. The legs of all people are also of different lengths. But we must exclude other problems. This is not a disease, different leg lengths. Now we look at these bones. They are on the same level with you, and just this seam from the pants helps us well. It is perfectly even. When you put on panties or a swimsuit, you probably cling to these bones. They will cling perfectly here and you see that they are parallel. Now we bend our legs and check. Inguinal and purpuric ligaments. What spasm they are in. They are both in spasm. Now we check the work of the hip joint in the abduction of the leg. We take our leg to the side. We are looking for a block. Do you remember? Standing, I diagnosed you with a block. Now the left leg, we rest our feet on the knee and take. How do you feel? The left leg is less abducted. Now let's check the strength of the muscles. First you need to check PSOAS on this side. Do the following. I hold your pelvis, legs here, and you move your legs in the other direction. Okay. Now on the other side. I lead this way. Push. Okay. Now roll over on your tummy. We will check the piriformis muscle. I push my leg towards me, and you push away from me. I put my hand on the promontory of the sacrum, hold the pelvis so that it does not rise, and push it here, and you resist. Okay. This is called the tonus rate. Now we check the other leg. And this leg is weaker, do you feel it? And you already begin to turn the pelvis. You turn on the pelvic muscles, buttock, abs, back extensor on the right side. Let's push. You feel that you have connected these muscles. You engage the gluteus maximus and medius, right side abs, back extensors and gum strings. Now let's check the hamstrings separately. You will pull the heel to the buttocks, and I will hold. Hamstrings strong on the right side. Also good, but slightly weaker. While standing, I found out that this left bump you had higher. This bone is slightly higher. Now we have to determine if she has a skewed pelvis or due to the fact that the legs are of different lengths. We have excluded a standing pose. It is now lying. Gravity does not affect it. Checking the legs. Yes, you have the right leg and here it is higher. But, GLE logic, if the right leg is higher, then the bone should be higher on the right side. This is all part of the leg, right? This bone of the ilium, it continues the leg. The leg is clear here, and this is the pelvis as a continuation, but we have it on the left side higher. You know why it happens? Because she does have a functional hip block. Look, this is the hip joint, this is the acetabulum, and this is where the femur bone comes in. It is round, spherical, and here it comes in. And here she can get stuck somewhere. And when it does not work properly, what will it do? It will pull up this whole iliac bone a little higher, and this anatomical point will be higher.
Atlant Medical Center.